Gmail up and operating.
It's on the, yeah, on calendar invitation.
Have we confirmed that we have?
1, 2, 3, 4, 5, 6, 7, 8. Plus. Adam Peterson is going to be a little busy.
Too short? Do we have Andrew Grover? We got 4 lunches over there. Oh, did we get Jasid?
It is the 11th.
Okay. What other names do we have on lunches? Oh, gosh, really?
Here's running late.
What do we got?
Here's running late. It's not coming. Ebony should be here.
Okay.
Oh, she is here. All right. Ebony is here. We might have to.
What is plan?
You were in private practice.
Private practice.
No, it's okay. We got room.
You can make that. That's what I
How are you?
It just.
Hello.
Bro.
My party.
Consistent, so people they are.
Well, this is rare that we don't have quorum.
You need me to call Emily to pop in.
Oh yeah, she said we could do that. Yeah, I can text her.
Okay.
Did we hear anything from Andrew Grover also? I can text him. Is he on there?
Yes. Okay.
Okay. Now we're at 12.
Emily, Andrew, Adam Peterson, who's gonna make it?
Well, it sounds like we've got a meal over there, so I don't know if she's on this side of the hill. Or...
Actually, I could go.
Great.
After she's in their order.
Right. Do you have Sonia's cell? I don't know what I do. Yes, thank you, Katie. I got that. So I do have Sonia.
Oh, Sonia's excused.
Oh.
Why do we have food for her? Who knows? Got it.
Good reason.
We are not actually voting. I don't know if we can begin.
Okay, yeah, let's just get into it. We can,
Let's just go.
yeah, let's just go. Yeah, and we know folks will be here eventually. So. All right, welcome, folks. It is June 16th, believe it or not. Summer solstice on Sunday, which is wild. I'm not sure how we got here this year already, but here we are. It's nice to see you all in person. Those of you that are here, nice to see folks online. Appreciate you joining us. Let's get into it. All right. Agenda overview, you can see it there. HR1 impacts are looming. Some have already hit, more are coming. We're going to talk a little bit about that. We'll have some space for public comment. And my understanding is we do have some folks who are signed up for that. Got some strategic plan updates. And then we'll have some announcements. So. And I will read off council members by twos as we usually do. I will skip those that I know are not going to be here. So Allison Stark and Sandra Santos.
Excused and excused.
Oh, excused as well? Okay. I know Sonia is excused. Jackie is excused.
No, I'm sorry. Allison is excused. That's why she's highlighted.
Okay.
Someone is excused and forgot that she also excused.
Okay. So Sandra Santos and Tyson Payne then.
Just absent.
Okay. Anderson Du Bois and Kyle Johnson. Kyle here. Judge Marisa Gates and Jacide Nunez Pineda are here.
Judge Gates is here.
Dan Toma and TJ Foltz.
Dan Toma is here.
Ebony Clark and Melissa Weddle.
Melissa Weddle.
Ebony's here.
Zafir Michael Berry and Courtney Esparza.
Courtney's here.
Lacey Andreessen and, is excused, Christina Matusik and Acacia McGuire Anderson.
Aisha's here.
Christina's here.
And David Ratu and Leah Tucker.
Mister.
David's here.
And then Adam Rokowski is here. And oriented ×3. So,
And can we name, we've got two proxies in the room. If we can just let them say their names and who they're standing for. They're not voting, but they're here to carry the faith back to their respective bodies.
Hi there, Remy Watts, she, her pronouns, here for Kati mostly at Oregon Department of Education.
good to see you, buddy.
Suzanne Gall for Emily Cooper, Disability Rights Org.
Thanks. Good to have you. Cool. All right. Group agreements. Again, members of the public can speak to the council during the public comment period. For those of us that are here and virtually, please be present and participate. Let's be respectful, try not to interrupt others, use names and pronouns people introduce themselves with. Try and avoid acronyms, it'll happen. Please feel free to call folks in to explain said acronym and drop them in the chat as well, the definitions. We're going to have different ideas because we're a varied group of individuals, so we can challenge ideas, but be respectful and not challenge the people behind. Honor those with quieter voices, lean in or lean back. Again, no individual problem solving in this meeting, but we're happy to help manage those offline. Our purpose, again, is improving the system of care for Oregon, specifically young folks 0 to 25. And be thoughtful about power dynamics in the room and the positionality you might hold. And then always be solutions focused. Oregon is great at admiring a problem. Sometimes we struggle to execute on the solution. So we'll try and continue to shift that window. So, fair enough.
Here we go.
Our mission, again, is there on the left. I'm not going to be that guy that just reads the slides, so you can see the mission. Y'all should know it by now. If you don't, I'm happy to send you a postcard that you can put up at your desk. But we are centered on children, youth, and families, increasing awareness and reducing stigma, promoting sustainable change in times of turmoil, prioritizing community-based care, and advancing equity by improving accessibility, affordability, and quality of care. Our priority populations in our strategic plan, which we have copies of in the room and also is available online: rural youth and families, youth experiencing homelessness or houselessness, youth involved in child welfare, youth involved in juvenile system, and folks with disabilities. People with, I just want to make sure we're defining the people with disabilities piece. Physical, deaf, or hard of hearing, visual, intellectual, developmental, learning, mental illness, etc. This is not an exhaustive list, but are elements of disability that should be considered. So just want to make sure I call that out. And yeah, next slide. Now that you've heard me talk for a little bit, I'm going to pause and turn it over to Jessica Dees. Did I pronounce that correctly, Jessica?
Thank you so much. Yes, Diaz.
Okay, cool. And you are the Oregon Health Plan Community Engagement and Communications Director. Here to share a little bit about HR1 impacts in Oregon for kind of our awareness as we continue to try and advance this work. So I will turn it over to you, Jessica. Thanks for being here.
Thank you so much. And may I share my own slide deck? My apologies, I didn't get it to you all in time.
Marina, I am not able to make her a host.
Let's see here.
It's a good time to wrestle with your chips if you need to.
Oh, that's not it. Got it.
Did it work, Jessica?
Yes, it
Sure.
did.
All right.
Excellent. And then if someone can out loud affirm that they can see my slide. Thank you so much. All right. Hi, everyone. Let's see. I was just introduced, so I won't do it again, but I am here today to talk about some of the impacts to House Resolution 1, also known as HR1. The acronym will probably repeat itself quite a bit in this presentation. And I am going to share some changes that are sort of like entire household, because I do think that this larger view of, what directly impacts children and youth as well as what is impacting their families might be important to you all. But please feel free to, I have the chat pulled up and you can interrupt me at any time, as far as if there are places you'd like me to spend more time or less time as I speak today. So we have some grounding slides. We like to make sure everyone's on the same page about what we're talking about when we talk about Oregon Health Plan. I might go through that fairly quickly, as well as then talk more about HR1. Some specific things within HR1 are the OHP work or other activity rules, changes to retroactive coverage in OHP, as well as a timeline for more frequent renewals. When we're talking about Oregon Health Plan or OHP, this is our Medicaid program as well as some non-Medicaid programs within Oregon that provide healthcare coverage for folks, including medical, dental, vision, prescriptions, behavioral health, and a whole lot of other benefits and services. We do have most folks who are OHP members on coordinated care organizations, but people do also, about 7 to 10% right now, are on open card, also known as fee for service. And there are folks who experience a mix of coordinated care through a CCO as well as open card. And I do always like to plug, because so many other health coverage options are not open year round, that OHP is open year round. I think that you all want more substance, so I'm going to skip a little bit through some of how people qualify for OHP. I do want to affirm that as we talk about things within HR1 that limit or make more burdensome keeping those OHP benefits, that at the Oregon Health Authority, we do strongly believe that keeping people covered is better for everyone in Oregon, and we're going to do everything we can to maintain coverage within the structures that we must work within. And that's my segue into House Resolution 1 or HR 1. This is one more affirmation of our values and our goals here, which is to keep people covered, do what we can to reduce inequities and harm, while also knowing that we must adhere to these new federal rules. So there are some pretty sweeping effects of House Resolution 1 across the nation as well as within Oregon, calling out some of those, and some of these I'll be speaking to, and some of them I won't. But we will talk about work or activity rules, some changes to non-citizen eligibility, retroactive coverage, some of the things that I don't have slides for today, but I can come back and speak more to in the future is the introduction of co-payments, things around the health insurance marketplace. I don't have any content specific to SNAP, but I would love to bring back some of my colleagues who are working on these different impacts to the Supplemental Nutrition Assistance Program. And also, I'm not going to cover today the provider taxes and state-directed payments, but I can come back if that is of interest to you all. As far as some of the things that are coming first when it comes to OHP and changes due to HR 1 and other federal requirements, in October of this year, about 7,000 people who have specific immigration statuses are going to move from other OHP programs into Healthier Oregon. And that is because HR 1 narrows the definition of someone who is eligible for full Medicaid benefits, that qualifying immigration status. This is only a change to adults and not to children. So these 7,000 people are all adults. None of them are in that younger category. Also, this is the first time some people will receive notices about needing to meet the work or other activity rules in the future, because we do have that notice going out 3 months in advance of when that change will first start to impact people around the work rules. And that leads us to January 1, which is when the work or activity rules begin for some adults. And I'll talk a little bit more about for whom that applies. January 1 is also when we must limit retroactive coverage timelines for people who are newly applying. And this is not an HR 1 direct impact, but Healthier Oregon members will move from CCOs to open card coverage on July 1 as well. And I see a hand.
Yeah, we've got a question in the room, Jessica. Thanks.
Oh, thank you. Hi, Jessica. Remy Watts from Oregon Department of Education. I was just wondering if my memory serves me correctly, the Healthier Oregon program, that is like essentially like an Oregon health program that is paid for by the state, right? And so it's like almost like the OHP benefits for immigrants that are paid for by the state, and that's why immigrants are being moved to that program. Is that why? Or like, I guess the point of the question is Healthier Oregon a program that is protected from like larger changes that are anti-immigration at the federal level?
Great question. And I put this slide in an appendix just in case we needed it, and we do need it. So a quick note about Healthier Oregon is that Healthier Oregon is mostly state funded. It's about 2/3 state funded, 1/3 federal funded. It is a state program, but it has in our state law specifically been modeled on Oregon Health Plan eligibility for everything other than immigration status. Unfortunately, what this means is that when we are looking at changes to OHP eligibility because of HR 1 and these other the federal directives that we are being given, some of those do apply to Healthier Oregon as well. And that's one of the reasons why we are transitioning Healthier Oregon members into Open Card is as a way to protect this program, because there was recent guidance from CMS, from the Centers for Medicare and Medicaid Services, that there are some pretty specific limitations to the managed care opportunities for non-citizens who do not qualify for that full federal Medicaid. So this is a change that we are making in order to adhere to that federal guidance while keeping folks covered with full OHP coverage within that Healthier Oregon program. And I just opened up a whole new can of worms, so I want to pause and see if that creates more questions, or if that helps clarify.
I hear you mentioning like citizens a lot, but what about other people that have like a legal migrant status but aren't citizens?
So I've been talking about non-citizens. So that is a whole range of different immigration statuses or a lack of immigration status.
Does that answer your question, Christine?
No, but I.
So I think all the things that she was just talking about are for any non-citizen, anyone who is not on legal citizenship. So whether you're a green card holder or a parolee or in undocumented immigrant, all of those things that she just said apply.
And then those folks get moved off of Oregon Health Plan.
They get moved
To a different type of Oregon Health Plan.
Gotcha.
Yeah.
Yeah, they're getting a different type of Oregon Health Plan that's not federally funded.
Yeah. So essentially, because and Jessica, am I understanding this correctly, that like, because CMS is no longer allowing Oregon to draw federal funding, Oregon is using state funding to continue to cover those folks who are non-citizens, but just shifting that to more of a state dollar burden?
Some of what I'm hearing is accurate, and some I'd like to.
Please do. Yeah.
Okay, so Healthier Oregon is a program that was created through a House bill here in the state of Oregon in 2022. And it is for people who do not have a qualifying immigration status for federal full Medicaid benefits. And there's a lot of nuance here because there are quite a few immigration statuses that are qualifying. One of the changes because of HR1 is that qualifying non-citizen or qualifying immigration status, that definition is narrowing as of October of this year. So there are people who currently are on federal Medicaid, and those federal Medicaid rules are changing. The good news is here in Oregon, we have Healthier Oregon to catch the folks who otherwise would be losing their benefits and move them into this largely state funded, but it is still a state and federal partnership due to how the bill was created for Healthier Oregon, because we are leveraging federal funds for the things that, like emergency services, pregnancy related services, those are covered federally and will continue to be covered federally. We've wrapped around an OHP program that puts state funds into the other portions that would not be funded through federal Medicaid match. And this gets very jargony, so let me know if there's something I can restate.
Does that people feel like they got their questions answered? Okay, great. We're good, Jessica. Thank you.
Okay, and I hopped around a little in my presentation, so one moment. I was on the timeline. So we got through January 2027. Just to give those last few items on the timeline a little bit of time, we're also going to need to implement more frequent renewals in late 2027. That coincides with when the continuous eligibility rules that are part of our current waiver with the federal government, that 5-year cycle ends in late 2027. So we were able to give folks a little extra time on OHP without having to renew them, and we're having to walk back and change those rules. to align with HR1. And then I won't be talking too much about this today, but looking even into 2028, that's when things like co-payments become a part of Medicaid, and we will be operationalizing that as well as a few other things. I am going to speak a little bit about those work or activity rules. This only applies to adults, and it only applies to adults who are not in OHP programs because of a disability, who are not dually eligible for Medicare. It also doesn't apply to any folks who are on programs based on pregnancy status. Only adults 19 through 64. And if this does apply to someone, they need to either show an exemption or to show a qualifying activity, which is one or more of work, volunteering, or education and training. We have an image that I am calling the funnel to sort of start to visualize for whom this applies. So out of all, oh, sorry, I see a hand and I can pause. Ebony.
Yes, I thought, am I correct that it doesn't apply to individuals with either a SUD or SMI diagnosis as well?
That is true. Here's a list of the exemptions as we currently know them, with me giving a small caveat of we just got on June 1st another 370 pages of guidance that we're still going through from CMS. But here, people with a substance use disorder or who are in substance use disorder treatment is one of the worker activity rule exemptions.
But
so I'm on HealthShare's strategy team around how we would keep people engaged, what this would look like. And so we've done a lot of work also on this. And I just want to say the definitions are going to be really important about when somebody qualified for a substance use disorder, who diagnosed them, what that looks like, and how it's defined. And those are the things we're still missing. And so yes, this is true in writing, but how it gets implemented and what the process of showing this is still in development, and it's gonna be kind of I would say it's all in the details about how it actually plays out and who would be exempt.
Adam, who writes those definitions?
Jessica might have more insight into that, but there is a group called there is a group of high-ranking folk who are all working to make those definitions or make the definition recommendations and then submit them to CMS.
So it's an Oregon state responsibility to define those populations and then get it approved by CMS?
Jessica, that's my understanding. Is that yours?
Before June 1, that was my understanding, but there was some of the, and I can't speak to it because I haven't yet synthesized what's in that almost 400 pages of new guidance. It included some changes to what we had previously expected. So instead of me affirming or denying, I think this is my promise we're continuing to dig into it and see exactly what, there are some changes that are surprising, that offer, I think, a little less in the direction of states making these determinations and a little more towards a central federal definition. But I don't know the details well enough to speak to them yet because this is brand new.
Remy, did you have a question?
Yeah. Hi, Jessica. Remy Watts from ODE. I really appreciate this slide, and I really love that parents and caregivers of children who are under 14 years old will continue to qualify, which is really important to me. But I was wondering, I'm not seeing the youth with special or the young adults with special healthcare needs, the WISHN population that was part of the 1115 Medicaid waiver. That is really important to this group. The WISHN population is a new Medicaid population that lets kids who turn 19, who have special needs and disabilities, continue to access the same level of Medicaid until they're the same level of OHP until they're 26. And I was just wondering if I see the former foster youth up to age 26 on this list. And I was just wondering if WISHN were in the conversation or in consideration to continue being like outside of the worker activity rule exemptions. Because I feel like a YSHN, like if you qualify for YSHN, you'd probably qualify for some of this stuff too. But it's like about the income eligibility. But anyway, I was just wondering. Thank you. Sorry.
Yeah, excellent question. Unfortunately, the guidance that we got from CMS was that YSHN is not categorically excluded here, but I would expect most, if not all, people who qualify for young adults with special health care needs would also qualify potentially under those clinical or medical exemptions.
Yeah, I'm seeing like a lot of overlap there. So I can think of like a couple of examples that would worry me around like mental health disorders, like some anorexia or some that kind of vein of mental health disorders. But thank you, Jessica.
I think one last question in the room, unless
Yeah.
somebody else has one. Is there a definition to the term high unemployment?
There is, and I don't have it at my fingertips, so I'm going to write myself a note.
A lot of Oregon counties qualify under the definition of high unemployment.
Yeah.
All of Eastern Oregon qualifies.
I figured there was a definition, so thank you. Yeah, and you can, yeah, if you find it, send it to us and we'll get it out to the group.
Can do, thank you. And then I
And
do
thank
still
you
see
for-
a hand up.
Oh, that's me. I was
Okay.
just holding it up for the room. I'll lower it now. Yeah.
Thank you, Jessica.
These are good questions. Thank you so much for I like this interruption, so it makes sure that I'm giving you all good, useful information. Let's see. So out of all OHP members, this is only applying to adults ages 19 to 64. It is not applying to certain programs categorically. Those tend to be the ones based on disability, pregnancy, or dual eligibility for Medicare. At that point, there will be a need for someone to demonstrate that they are working, volunteering, and or enrolled in education. And we looked at this, but I was going to specifically point out the parents and caretakers of children under 14-year-olds or someone who does have that serious or disabling health condition. That is an exemption that will absolutely be in play. And in fact, you also called out former foster youth, so you got to my talking points before I did here. And there are ways in which this list may evolve as we work through that most recent CMS guidance, which you might hear me say a few times. I see a hand.
Hi, Jessica. It's Remy again. One last question. I was just wondering, are the feds defining how people are going to be applying for these exemptions for like the OHA worker activity rule exemptions? Or is OHA going to be able to design how folks are going to be able to tell OHA that like, yes, I am a caretaker for somebody with a serious health condition, or like I'm a caretaker for a kid or a foster kid or something like that? Like who's defining that application process?
I do, where I have heard the most conversation and where some of the CMS guidance has been most surprising is around those medical exemptions, which is where people are able to self-attest versus where we would need some sort of ex parte, like clinician um, documentation. Um, Right now, it looks like at the first time of applying, people may be able to self-attest because there is an understanding that people may not yet have the health coverage to be able to have that documentation of having a serious or disabling health condition. And then after that, quite likely we would need some sort of in systems or as part of a request for information. We have that confirmation. I haven't yet dug in enough personally myself to know how the newest CMS guidance might adjust the self-attestation for some of these other exemptions. But that is absolutely a conversation that is continuing with CMS and OHA around where we have that ability to build systems and to rely on things like self-attestation, and where there will need to be aspects that there is documentation of what that documentation needs to look like. This is unfortunately one of those more soon. We are continuing to build it actively while also some of these goalposts are moving a little actively as we do so.
Thank you.
My last slide about worker activity rules is just adding some clarification on what it means to meet an income requirement that is more than $580 per month, what it means to meet that education requirement, which is high school, GED, or at least half-time enrollment in higher education. And then I would say these are two ways in which people can qualify. If they don't qualify for either of these, then it becomes at least 80 hours monthly of work, education, training, or volunteering, any mix of those. That could be a combination. I have a little bit of information about that retroactive coverage. So this also starts in January of next year. When someone is newly enrolling, they can ask for help with recent medical bills. So we call that retro coverage or retroactive coverage. Currently, OHP members can get up to 3 months of retroactive coverage. HR1 shortens that to only 1 month for adults in that expansion population, that adults ages 19 to 64 who are OHP eligible for reasons that do not rely on that disability or pregnancy status, and then 2 months for everyone else, essentially. So this is a narrowing of that timeline for retroactive support with recent medical bills. I see a hand.
Yeah, is that retroactive date from the start of, there's been a long time since I did OHP eligibility way back in the early 2000s. But at that time, it was based on your application date. Anything would be covered forward from that. Is it still eligibility based on that application date and retro, or is it approval date and retro?
It is application date, unless I am 4 years removed from doing that day to day, so I also am a little rusty, but 4 years ago it was absolutely so as of when someone applied, and in fact, let's say I apply on the one system today, it's the 16th, it's very possible for me to get immediately that OHP coverage. My coverage would go back to the beginning of this month, and those 3 retroactive months would be 3 months before June. So that would be, can I do math live while on screen? June, May, April, into March. So that's the time frame that is being limited.
Okay, thank you.
And then, oh, sorry, I should pause. Are there any other questions? Okay, I'll move forward. And then let's talk a little bit about more frequent renewals. So this has a slightly different timeline, and that is because we are currently waivered with the federal government to provide continuous eligibility, which means that most OHP members renew only once every 2 years. The guidance in HR1 runs very counter to what we are currently waivered to be able to offer. And so that means that some adults will renew every 6 months, and then all other OHP members will renew once per year. This is something that in other states is happening sooner, but because we have this waiver with the federal government, we are able to keep continuous eligibility through that 5-year cycle, which ends September of 2027. I will say that the case we made for doing continuous eligibility was that there are quite a few folks who, and the terminology is who churn off of Medicaid, not because they're not eligible, but because the paperwork, going through the process, responding to requests for information, completing a renewal, it is quite, that's a lengthy process that can be hard to navigate. So we do recognize that this will likely create a situation where more people are uninsured in Oregon, and likely not because they're not eligible, but because it becomes harder to keep that coverage. And now I do have a few slides that are about our communications and engagement approach, but I also am realizing that I promised to talk for only 20 minutes and then to have a conversation for the other 20, but we've kind of integrated it throughout. So I want to check and see, would you like me to speak more about communications and engagement, or should we maybe do more open conversation?
Yeah, I think from the looks in the room, I think we're good to just keep rolling. And yeah,
Okay.
it's been a nice back and forth so far. So thank you.
Okay, thank you.
Oh, there's maybe a question in the chat.
Let's see, will Healthier Oregon and Bridge follow this renewal process, or what are your expectations for these groups? Let me go back because I believe this is on renewals. So for some Healthier Oregon members who are in that adults category and other than immigration status are mirroring that OHP adult expansion group, they would need to renew every 6 months. And there are Healthier Oregon members who are eligible through those other pathways that would renew once per year. And this is also where Healthier Oregon members who are children would have that once per year renewal cycle as well. So that's not Healthier Oregon is not a single cohesive benefit package and set of eligibility factors that will all go in the same direction on this change. And that is they will be aligning with whatever the other analogous OHP group is that mirrors their eligibility factors. Oof, that was a lot of jargon. So the answer is complicated for Healthier Oregon. I believe Bridge is 1 year, but that's another one where I want to absolutely make sure that I'm giving you good information. So I'm going to double check. And when I send this slide deck out, I'll make sure I'm affirming that information as well. Hillary, did that answer your question?
Yes, it did.
Thank you. Okay, I will move on to our communications and engagement approach. And you will notice we're already deep into our phased communication approach, which is we started from a place where something that often happens with changes like this is that people start hearing about it even though those changes are not actively in play yet. So the first phase was really focusing on clarifying that things have not yet changed for OHP. This was especially complex because some things in SNAP did change right as soon as HR1 passed federally. So really focusing on that continuity that people can prepare for changes, but that they should not be expecting to get new notices or changes to their eligibility yet. We are now deep in the timeline where we're in phase 3, where we're starting to get more granular about what those changes are. We're updating our website with 2-pagers that go into more detail about these different aspects of HR1. And I have a slide that has that URL as well for your access. As the changes start to happen in phase 4, starting September, before those non-citizen eligibility changes happen, active information about how to stay covered and how to best navigate the notices that will start coming, as well as what it means for households and members. And then once we get to the end of this year, beginning of next year, really focusing in on the changes that people will be experiencing as they begin to renew. So as a reminder, those work or other activity rules, they apply at time. Actually, not a reminder. I think I missed my talking point when I was being conversational. I should say that now. So the work or other activity rules apply at time of application or at time of renewal. So when people get that renewal notice, if someone in their household may need to meet those worker activity rules, they will also be getting that information. There's a big mailer going to everyone at the beginning, and then there will be more tailored information for their specific household and what that notice says and what response is required to either show an exemption, show that the worker activity rules are being met, or there is a possibility that, and we think it's only about 2% of folks would actually, because they are not working and they don't have an exemption, would potentially have their benefits closed. We are working very closely with ODHS because there's a lot of alignment with some of these, especially the work rule changes for OHP members and SNAP participants. So we are looking to align that direct outreach where people are directly impacted as members. As much as we can, leveraging those existing partnerships, building out what already exists, for instance, the Office of Community Health and Engagement, Application Assister Network. And then there is an aspect of this where how can we connect with what are for Medicaid, non-traditional partners, especially around those work and volunteering opportunities, and continue to check in about what the data are telling us about what people are experiencing and what types of interventions are appropriate. We are also looking into all of the ways in which members are allowing us to communicate with them so that we can have letters, emails, texts where people have opted into those different types of communication, as well as having broad updates on that website that I mentioned, which is, I see the link is right at the bottom of this slide, ohp.oregon.gov/HR1. And then also a strategy to really lean in on where are those trusted relationships already, whether it's with someone's provider and making sure providers have the information they need to understand what's changing about OHP and what that might mean for their clients, to community partners and community-based organizations, as well as working closely with CCOs. Oh, yeah.
That isn't, I'm sorry if this is like a total left hand curveball, but this whole conversation has been about sort of the individuals and the impacts on the OHP members, and that's really important. But I'm curious if we are talking about thinking about planning for the impact on the systems that OHP has been paying for, as we're like losing paying customers. How are we thinking about like the shrinking size of the system and the impacts on providers and access to care and those things? Like, who's talking about that?
Yes, and I will acknowledge that the slides that I have today are largely focused on the members and not on the systems. And I'm also realizing that we're about 6 minutes from the time my time is up. I can speak broadly, but I think this probably does bear maybe coming back at a later date and talking more in depth. And I would bring some folks who are more knowledgeable about those system impacts than I am. That in addition to these specific things that I'm talking about, HR1 is also a significant change in funding and resourcing at the state level from the federal government. And so I do know that there's a lot of conversations happening around how do we maintain our OHP benefits and programs, and where will there need to be further conversation and at some point really hard decisions to make about what that means to navigate this changing environment of resources for Medicaid programs. And I definitely don't have the talking points on hand to speak really intelligently and granularly about that, but I do think acknowledging that that is absolutely in play as well is important.
Remy and then Adam.
Hi, Remy Watts from ODE. Two things, Jessica. I first of all wanted to, like, on the communications piece, I just wanted to make sure you were aware of one of ODE's strongest communication partners, Kevin Alejandrez, who is in the office formerly known as CPOP, that you said the name of, and I can never remember for some reason, the community health outreach. Yeah, and
Yeah.
Kevin, I just wanted to make sure that y'all were thinking of schools in the K-12 system as valuable partners in reaching out to parents and making sure parents are aware of these changes. And also to Anna's point of what are the systems that are going to be impacted, what are the, there's the direct impact of HR1, but then what are the seismic waves that are happening? And we see at ODE, we talk about this a lot. We see HR1 declining the amount of health benefits that go to families and their children. And, children will, air quote, continue to be covered at the same rates. But when parents aren't applying for their own medical coverage, we're likely to see children start to slip through that as well. And at ODE, we think a lot about how schools are going to be filling that gap. And how schools are community health hubs. And very interestingly, school Medicaid is a different source of funding. It's a different funding pot. It's got different rules, and it's also not included in these HR1 impacts. There's a lot of nuance to what I'm saying. School Medicaid is not a magic Band-Aid that's going to be able to fix every single gap that HR1 is creating in medical access for children, and especially children with special healthcare needs. But it is something that we are working on. I won't bore y'all with the details right now, but we at ODE are working on ramping up schools take up of school Medicaid, because school Medicaid is truly a very underutilized funding stream in this state, and it's really going to be much more important with the impacts of HR1. So that's one way to answer your question, Anna. It's a non-answer, I recognize, but yeah, luckily we've got a couple years to ramp up the popularity of school Medicaid, and we've got some tools in the upcoming accountability implementation framework in order to push this kind of stuff. But that is one way that we can, it is part of the toolbox to address the impacts of HR1 statewide.
In the chat, I'll just call it out. I'm not sure if the machines have officially taken over or if there's a human behind that ODHS number there. But somebody says, I'm actively working with Kevin and the team to formulate comms for our education partners.
Wonderful.
Stay tuned.
Yes, we love that. And the work remedy, yeah, it's a partnership. That might be somebody I work with too. Hello.
Remember
Oh yeah, I went to high school with them.
Oh, it is Molly. Oh.
There's a group led by Dr. Bruce Goldberg who are designing the what ifs. And my recommendation would be to you as the executive director, reach out to them about what those what ifs entail, how that might impact kids. I think that it's going to be largely looking at kind of the what, the how and the what of the impact. And I think a lot of it really is unknown. Like, I mean, I know the amount of impact that's going to be on health share, which is Oregon's largest CCO, and it is potentially very significant. Even looking at the HOP numbers, the folks who are on Healthier Oregon, it's a significant amount of people who will be then covered by a different form of Medicaid, and the HOP population will essentially double the amount of people that are on open card in the state as well, meaning that there's going to be a big learning curve for those who are coordinating care and who are entering this open card system of care.
I just learned there are no rules for care coordination on open card. It's like there is not a single standard set yet. And so that is definitely a conversation that needs to be had. I see Anderson's hand up as well.
And that's a part of the thing I was looking at when you were asking about high unemployment rates in counties. Because if we're talking about Eastern Oregon counties and the strain on that, are those CCOs ready or able to sustain that? I feel like that's where a lot of that conversation should probably be, spreading out our resources.
Yeah, the highest percentage of populations on Medicaid in Oregon are Eastern Oregon counties. Rural hospitals are already at incredible risk, and if Medicaid populations continue to decline, will close, which access to care, you're already going further for access to a hospital. And if the hospital in Burns closes, then you're, 2 hours away from a hospital instead of 1. So yeah, there are major negative impacts to rural and frontier Oregon that I think folks are very, very concerned about.
There's no way to share the love between the different CCOs.
Their impact will not just be on rural.
Right.
This is, we have about 460,000 members total, and the potential impact is somewhere in the hundreds of thousands that could lose coverage based upon how definitions are included, like who follows up with their with work requirements, how they're able to submit work requirements, what that looks like. And so we're talking about a very significant amount of people who are accessing, especially like the most hospitals are in this region, and people from all over the state come to the metro region for hospitals or for hospital care. Then these hospitals will be providing uncompensated care to a lot more folks who now are covered by the Oregon Health Plan who will not. And so the impacts are like, I don't want to paint a super dire picture, but it is dire.
Yeah.
And much for Oregon. It's highly possible. The impacts may be different, but they will across the state.
Because the hospital will find a way to recoup those costs, and it will be from those who are still insured through the private plans and whatever. And so rates will, it's
the other thing is the Rural Health Transformation Funds, Anderson, that the federal government also dispersed in an effort to
offset.
Offset the impact a little bit. I was trying to think of a more accurate word. Diffuse the impact. I don't know. And they're very specific and restrictive and challenging to implement, and absolutely will not backfill into everything that we lose. Right? They'll do some things, but they won't do all of it. But it's sort of like, oh well, we're really going to hit rural Oregon hard. We're going to try to reinvest in rural Oregon. Christy is actually on that project. She's on vacation right now, but we can have her talk a little bit about what she's seeing in that next time too. But it's not gonna be 1 for 1. There will be dramatic and negative impacts, and it like sky is falling is not too dramatic in my opinion.
That makes sense.
It's a great time for American democracy.
Just asking equity-wise, what can be done? I'm born and raised in Portland, so I know the resources are here. Just what can be done, knowing that it's not going to be the same in other parts of the state, knowing it's going to hurt here too.
Yeah, I'm happy to reach out. I think that's a great idea that Adam suggested, that I reach out to Bruce Goldberg and see what they're talking about, and if there's things that I would like for us to have an opportunity to have a voice in that conversation.
Yeah.
So I will see if that is something that they are open to. Jessica, do you want to say I know we're slightly over time on you.
Yes, I put some resources in the chat. That was pretty much the last slide that had content on it. I will also make sure to get you all this slide deck, as well as chase down a few of those specific questions. But I do think this is the beginning and not the end of a conversation. And thank you so much for spending the last 45 minutes with me.
Thank you
for being here. Yes. Okay, transitioning into public comment. Do any folks, members of the public, wish to speak? Feel free to raise your hand. Pop up. Happy to hear from folks now.
It's scheduled 15 minutes for public comment. Because there were some folks who were planning on being here, I think they weren't able to make it. So let's leave the awkward silence, and if anybody else has anything to say, and then we can take a short break.
Sure. We'll give another minute. We'll wait till 12:06 to see if anybody pops up, and then if no one at 12:06, we'll break from 12:06 to 12:50. All right, y'all know I'm terrible with silence and talk. It's not 12:06, but I didn't see anybody on the screen. We're all in here. Break till 12:15. I did my best. I'm a work in progress, everybody.
I'm not good at it either.
Be back at 12:15. All right, folks, welcome back. Thank you. 12:17. So we went a little long on our break because I was talking about dog training. So we'll catch y'all up who are online next time. We have some updates. Well, it's basically the Anna Williams show for the rest of the time together. So I will turn it over to Anna. She has some quick announcements and then some strategic plan implementation updates.
Thanks, Adam. Anna Williams, she, her pronouns, Executive Director, System of Care Advisory Council. And I first want to start out a little bit of a surprise, Anderson, by just acknowledging our lived experience team is here and fully operational. So Araceli, I know you know that you were being asked to introduce yourself online, but taking one tiny step back, REAP is the contractor we have for providing peer support for people with lived experience who walk into this work. Yes. Turns out it's not easy to come in here and share your hardest experiences with the folks who may or may not have been responsible for those, whether they did it on purpose or not. And so we have Anderson, who is an appointed council member, also leading the lived experience support team. We have our esteemed Annette Magic Odemy, lived experience chair emeritus, who provides family support. And we now have Araceli Granados, who will introduce herself and pronounce her name correctly, who is our youth support specialist. And so our lived experience support team is fully operational, and I'm very excited. We also have Elliot Hinkle, who provides support to our youth committee. And we have Vanessa Broadley, who is online, who provides support to our family committee. So a year ago when we said, Eileen's job is too hard, she cannot do this alone. And we were like, how do we figure out how to bring enough resources together? We worked together, we brought those resources, and they're here. So please use them. Annette is wonderful as a family peer support specialist. Elliot is actually a lived experience support specialist as well. So reach out to these folks if you want their support. Please do. Araceli, I'm going to stop talking and ask you to start briefly, just introduce yourself and maybe say one thing you want us to know about you.
Yeah, thank you so much. It is Araceli Granados. My pronouns are she, her. I'm the new peer support coordinator for REAP. I've had a lot of experience in the past 4 or 5 years, almost 5 years now, in youth councils and serving as a member on youth councils from like the Oregon Health Authority Youth Advisory Council. I'm currently sitting on the Youth Engagement Advisory Team as a youth member for REAP, and so that's where some of my experience comes from. And then also, I'm just glad to be here. So thank you for having me in this space. And this is a great conversation. So thank you. I'll pass it back.
Thanks so much, Araceli. So moving into strategic plan updates, one of the things that we had identified as a priority in our strategic plan was to build a real lived experience support program. So we can actually mark something done, and it's only the first half of 2026. If you don't have copies, I do have them here. Our strategic plan in Spanish and English is available for anyone who wants a copy of it. We have a quick little one-pager on what System of Care even is, again, English and Spanish. And these, oh, they're the old ones, I'm sorry. Only have English. Usually they have Spanish on the back, or on the front, depending on which language you speak. But this is the sort of one-pager version of our strategic plan. It has our goals, our strategies, our intended results and outcomes. So anytime you want to know what are we here to do, it's on that page. We have been working hard as your staff to figure out how, I'm gonna unpin you, Araceli, to figure out how to show you what we are accomplishing as this work is happening. So I was talking to somebody yesterday, and I've been calling us that we're sort of in System of Care Advisory Council 2.0. I was wrong. We're actually in 3.0. So the initial System of Care Advisory Council was when we were under OHA, and we were staffed by Hillary and Chelsea. Some of you, Jasit, Adam, have been here since that time. Annette, were you one of the members who was there? Right. So we're all the way back two whole versions of the council ago. Then there was a bill that was run, and we were sort of friendly, pushed out of the nest and moved on to become our own little independent thing. We got an executive director. We then started getting other staff. So that was actually SOCAC 2.0. Now under this new strategic plan, and with our new structure and our new strategies for how we're doing lived experience engagement and communication, we're under SOCAC 3.0. So one thing that I am noticing as we are maturing is that all of the folks who want to come work here are people who love creating systems change. Like, no one wants to come work at an organization developed to change systems who is resistant to change. So sometimes we forget that, even though a lot of you are all really interested in systems change, that change is still stressful. Change can be overwhelming. Change can feel threatening. Change always includes some kind of loss of whatever was, what was comfortable, what we knew, into something new. And so I think that we skipped a little bit of the change management work that we needed to do when we went from 2.0 to 3.0. I can't necessarily go back and solve all of that for us, but I can acknowledge that people maybe felt a little unstabilized as we changed over, and that we're still rebuilding some relationships and some communication strategies. So I want to sit with a little bit today. What have we actually accomplished? How are we going to continue to track progress, and how will people know? Because I think some of you all, like Courtney's like, what are you talking about? I'm new here. Like, I haven't seen much movement at all, right? And then if, Jasit and Adam are like, oh, things are so different from what they were, right? 3 versions of this council ago, right? So one thing that's cool about us is that we have a lot of new experiences coming in, and we're still able to hold on to some of that history.
For now.
Huh?
For now.
I know. Next year's going to be the year that all of our oldsters, including Jasit, first time you've been called an oldster, are going to be terming off for good. So all of our founding members, this will be the last round of them moving on.
What a legacy.
Change.
Speaking of change being destabilizing, it's really going to be sad to lose a lot of you.
Sure, I'll pop in and be angry in public comment at least once.
I look forward to that.
The filter's coming off.
Two of them are going to start telling us how they feel. So we are updating the implementation plan, which is on the website and is linked in the slide. I can click over and see, will it load if I click on it? Yes. Staff does updates. I think I got some from you, Adam.
Sure.
Did you just recently submit some updates? It's this email thing, and it goes out. So if your name is in the SOCAC sponsor, you sometimes will get an email that says, for instance, what's happened on developing strategies to recruit, promote, retain, and support a respectful, responsive, and trauma-informed workforce. And so here you'll see it says this March update. Oh, sorry. That was the last time that somebody entered an update into this status update. So we are now in the June process of updating these things, and you'll see the ones that are not started don't have anything written in their status update. This is all available on the internet. You all can go see it. You all can be like, I'm doing something here and it's not reflected here. Please send me that email. those make me so happy. The other thing, let me see, that you may want to be tracking, that dashboard that I just, or those updates that I just showed you, feed into this. Smarty. Which just takes a hot minute to load. And I know they're not ADA accessible, and we are hiring a communications person who will help us get there. We can't do all the things perfectly from the start. So when you look at your system of care strategic plan goals, this is organized in the same way. Goal 1, improve access to coordinated, integrated, and community-based systems of care. Goal 1, right here. 46% of the items identified for that goal have been started. 54% have not been started. That's what this sort of little gas tank indicator is showing you. And it's a little bit blurrier up here, I'm sorry, than I wish it was. On goal 3, you'll see create sustainable infrastructure that increases system of care's capacity and credibility. We've actually completed some of the steps in that goal, not just started some of the steps in that goal. So we're 12% complete with that goal. If you want to come down and see, well, what have we done that is 12% complete? You can click on that little tile at the bottom and it will take you to another smart sheet. And so then you can expand this column. My computer will work and it will show you what's been marked complete. So we modernized our committee structure to align with the strategic plan. That's what we were doing while you all were taking those leadership trainings, trying to figure out how do we build a committee structure that actually drives the work within the strategic plan. We ensured that there was at least one local system of care member on each system of care advisory council subcommittee. They're there, y'all. They're showing up. They are participating. They are part of the bi-directional communication that they have been asking for. And we have expanded youth and family peer support and technical assistance with the lived experience program that I just described to you all. So I know that they're like, there's so much work to do and you know, the system is terrible. And also the system is great. And also we're making a lot of progress and I can't, this, as you all know, we aren't doing the vast majority of the work that is articulated in our strategic plan. We are dependent on our agency partners, our provider partners to tell us when things are happening that need to be included in the updates, right? So June is the next round of quarterly updates. All of those dashboards that you just looked at are only accurate as up to March. So we'll start seeing, even as these updates come in and get added to those trackers, that the needles move even further and that we're making even more progress. So if there are better ways for us to get that feedback from you, please let me know. I know that a couple of our agency partners, sometimes I send them emails to be like, what are you doing in this realm? And they're like, that is not an email. And so figuring out how we can distill it to, let's make some notes about progress. Let's ensure that the council is informed that progress is happening without you having to stop making the progress and spend an hour writing an update for me, right? And so we're sort of in that tension between how much of the work do people get done versus how much of the work do they tell us that they got done? And sometimes that is challenging. I'm asking the governor's office for permission to see some of the progress reports that agencies send on their own strategic plans because we aligned our strategic plan with theirs wherever possible. So where those alignments exist, if I can just get visibility to updates those agencies are already crafting and sending, then I can count that progress, right? The work doesn't need to live in this room in order for it to be improvements to the system and for it to count for progress within our strategic plan. So trying to figure out how we do that in an elegant way that doesn't add more work for a bunch of people. But that's one strategy that we're trying to use. And if other folks have ideas for strategies, by all means, you can say them now, or you can email them to me later, or you can bring them up in whatever way makes sense. So the dashboard, which I just showed you, is really intended to just show you a high-level overview of our progress so that it feels like we're making progress. If you're ever like, what am I even doing here? Go look at that and see. And if you really feel like you could do more, there are some places in here where our SOCAC sponsors turned off the council and are therefore missing. So I'm sorry if I'm making you dizzy, but like this one, 1.3.1, draft a bill with people with lived experience improve the release of information practices and reduce paperwork. That's not intended to be started till 2028, but the council member who volunteered to lead that work is not a council member anymore. So we need another council member to be a lead person. And I'm not looking at anyone right now who might be a good person to do that.
Are you thinking about Leah? Are you thinking about Leah?
I'm not, yes, I'm thinking about Leah.
Okay.
What? I don't have to do that, do I? Or you doing nothing?
So weird that I knew exactly who on this one.
Find and offer best practices and programs that empower youth and family members to be their own advocates. We don't have a staff member assigned to that. It might be what I'm doing now, but I'm not staff or a council member. So if there's a council member who wants to step into any of these roles that are highlighted in green, we would love to see you volunteer. Implement collaborative problem solving across systems in a coordinated manner. That's the 2027 act.
Can there be proxy of a council member for that?
You are 1.3.4. Yeah.
Can council members, like, have, again, folks from their organization help with that?
Yes. If you have somebody in your agency or organization who is like, oh my gosh, this would light this person on fire, they would love to do this in partnership with the council, you can put your name here and you know that it's really going to be that other person. And then I will work with that other person to do it. Anderson.
Further down, delegate. Curious about color coding, and my name is spelled. And what is the
And your name is spelled.
roadshow? But that maybe is jumping ahead.
Yes. The roadshow is the go out to every CCO district in the state and have a conversation about what the new system of care looks like and feels like, and then figure out how take the themes from those and turn that into our plan for transformation for 2028. I think your name is on there for the lived experience support process, and we will fix your name being spelled wrong. I'm not in the editable version of the sheet, but Corinna, can you get into the editable version of the smart sheet and on 4.2.3 fix Anderson's misspelled name? It's Du Bois, not Du Bois.
But I realized,
I thought Anderson was spelled wrong. I was like, what? Oh, hold on. The whole time.
So feel free to look through here, find your green spot. Anyone want to investigate and make changes to the CCO contract? Suddenly, Adam and Courtney up there.
Wait, I can go back.
Well, now's your opportunity, guys. Give feedback to.
Yeah, you're gonna try to motivate me. It's a great opportunity.
what?
4.4.2, Anderson is curious about what that entails. So this says, work with the governor's office to create a children's cabinet to coordinate this work. So there used to be a children's cabinet in Oregon that was peopled by folks who had the authority to make quick decisions within the children's system and implement a lot of the things that we wish we could do. And that was under Governor Brown. It turned actually into us as it died. And we do not have the same level of authority or access to certain, like no one from Medicaid sits at this table, right? Medicaid is one of the things that we talk a lot about, one of the systems that we have a lot of, that we bump into a lot, and not having anyone from Medicaid at this table is a problem for us in terms of implementation. So the idea that was discussed at the strategic planning time was basically bring back the children's cabinet. There's political reasons why that might or might not happen. So
that essentially would be like agency director level people, right? So it would be, the director of OHA.
It would be Liesel Went,
right,
Dr. Hockey.
Yeah.
Right. But for us, it would be advocating to the governor's office to say this is important and this is why this is important and this is the efficiencies that it would bring instead of inefficiencies that it would create, which I think is one of the challenges that they're facing is like, how do we even get all these super busy people into a room to accomplish something. So.
Send proxies.
Explore new alternative and outside the ordinary options for funding. So some of these things that don't have a, bless you, don't have a council member associated with them doesn't mean they're not happening. Right, like Christy is pretty riled up on this alternative, new and outside the ordinary options for funding. So she's gonna be pushing on that topic, whether we have a council member sitting next to her and directing her work or not. So that we're with the fiscal assessment that we are working with ASU to create of what money is coming into the state, how for children's services, where is it going within the state, how is it getting spent within the state, and how are we tracking outcomes for that? Christy's already laying the groundwork for this, whether there's a council member associated with it or not. Like, I don't want to make it sound like you guys don't like totally matter, but our job as staff is to make this happen. Whether you all believe it or not.
I have a question like on that one though. There is like the financial subcommittee. So, and it seems like those are the kinds of conversations that we've been having in that too. So like, does it have to be a person? Can it be the?
I mean, it could be the chair, it could be the committee. Yeah, it doesn't have to be an individual necessarily. And like all of this work is going through the subcommittee.
Right.
So it's not, you're not being cut out of any of the work. If you're in a subcommittee space, you're doing some of this regardless of your name being on it or not.
The benefit of a name being on it is that there's someone that's held accountable to it. When it's a group, then the whole group is something you're able to also like put it off. So
I think a lot of times, like with children in temporary lodging, for instance, that's a little bit of everybody's job, and it's that Spider-Man meme where all the different Spider-Men are pointing at each other, where like nobody wants to hold ultimate authority for it, and so just putting an individual's name on it tends to help us have a lever to pull.
Accountability in systems work?
It's a new idea.
I didn't see that in the strategic plan.
Especially in situations like that, is implementing like the RACI matrix, where you can have these different levels of responsibility, so that pressure might not feel so
intense,
consuming. Yeah.
Did you all hear that? Okay. Yeah, I think that's a great idea, and I love Anderson as an advocate for the RACI. And I believe in it. I just haven't implemented it yet. I need to behave my way into RACIing like everything that we ever do. For those of you who don't know, a RACI is a structure where you decide who's responsible, who's accountable, who's consulted, and who's informed. And so it's just really being clear about what types of involvement people have in a change process or in any kind of task that an organization is doing. I see that some people are chatting.
Oh, it was me. Heather said that she loves that you knew that meme. And I said, we're not that old. We still know memes.
Only me, Anna, and Ellie that did the thing. I was looking around like, oh, just me?
Oh, I did it.
You did? Okay.
Obviously.
Okay, so we were in the perfect line of sight.
My strategy of sitting back here so that nobody can see me on camera is obviously working. So.
But laying low, you have failed at.
Too late, you have been pursued.
Okay, so now it is time for council discussion. We are not taking votes. We're just having sort of an open conversation. Those of you who are on the internet, please raise your hand, speak up via chat, Adam or Corinna, holler out that folks are chatting that need to be said into the room. So the question before us right now is, what is the best way to collect data about the work happening in support of the plan, both in agency and in community? Staff don't always have visibility to everything that's happening, like I just said. So Adam Peterson.
I think recently we've set up our structure to have all the different subcommittees. I think this could be, we could break out which of those goals fit into which subcommittee and then do monthly, or whether your subcommittee meets quarterly or whether your subcommittee meets monthly, that becomes an opportunity to at least check in about them. And then like a staff member can be there to take down notes about what would need to be updated or just have a regular check-in with the subcommittee.
Great, and I think each of our subcommittee charters actually have the goals that are articulated to them in the charter, so that actually should be, like, we're already partially set up for that. Awesome. It's like we did that on purpose. We probably did and I forgot.
Seemed like it was my idea.
That's Adam Peterson's idea all by himself. Anyone else have other ideas, like for, like Annette, for work that's like happening out in the community around youth and family voice, people feeling heard, being seen? I've heard anecdotally it's better. We have some specific goals about it. Is that good? Like we're just vibing on that and we're calling it good? Or is there a way to like measure that, to report that, to say things are changing and here's a way to document it?
Well, it feels like to me things have changed. There's been a real big shift. Seeing the membership or people attending pretty consistent. So that's a good thing. When we do our breakout groups, it feels like that individual voices are being heard. And that comes through in the report outs that we have. So yeah, it feels like it's growing. People are being heard, understood. And then when Leah and Christina report out, I think it comes through that voices are being heard.
And Leah and Christina, I know you all are gathering quite a bit of data in the family committee. I don't know if there's anything you'd want to add about that, but that is actually really, really helpful in turning what feels qualitative into something more quantitative for us. As an example for other folks to think about.
Yeah, I mean, I think it's been, I did not have the benefit of previous iterations. I did of this full council because I was a listener quite often, but not of back. So being a part of it on this side of the shift, it seems like we're getting some really good quantitative analysis coming out of those conversations instead of just, trying to then synthesize like what we heard after the fact. We're actually getting feedback from them within that space. And I think the nice part is that we have the opportunity to shift that also. Like as we go forward, we can change questions within those little surveys and change how we gather some of the data so we can make it a little more nuanced and, drill down or widen our data collection as we need to going forward. So I think it's been pretty successful so far. I mean, we've only had 4 or 5 meetings, but
the presentation that you gave at our last council meeting with the data that you had, it all came from the data that the family committee has sort of self-generated. Mm-hmm. Other subcommittees could do a similar process.
Yeah, and I mean it's been so simple. We're not asking, like for a massive amount of information from attendees. It's 3 questions at the beginning that are kind of like a welcome to the space. What do you want to hear today? And, kind of that bookend of what did you hear today and what would you like to hear next time? And that little bit of information has created this very, I think, robust conversation thread for us that we just keep building on.
So then what we're doing with that is linking it to the work that's happening in the rest of the subcommittee spaces, where there are family members who are saying like, it's mental health and disability that are my priority. Then we're saying, okay, this is where that work is happening over here. Go watch, think about joining. This might be the place where you really have a lot of lived experience to bring to that investments and finance table or that data and evaluations table or whatever it is. So there is, again, it's not always visible, but lots of cross-pollination happening between Leah and Christina and the subcommittees and the FAC. And I saw Anderson raise a hand.
I was just going to say, with the lived experiences report and survey that goes out, it was used, and there are folks that have, put in requests, but that has gone down over time, which seems to be more so the good thing of like a lot of those responses have been followed up very quickly. And so
that's Annette.
Yeah,
doing a really great job.
I just want to continue to put the kudos out there in that work. as folks are continuing to be followed up with, but the decrease in responses being filled out, I think just goes to show, I think, where things are kind of stabilizing out with a lot of things that are going on. Haven't been like restorative conversation requests.
Which has been, I mean, which is great, right? So less harm is happening because Anderson's getting less traffic around needing restorative conversations. Acacia is walking out, she's got to get to Portland. But I'll be emailing you soon for any updates that ODB is responsible for. Yep, that's great. So keep an eye out and feel free to flow it down to whoever has the help you with that. Need that right now, so happy to do that. Thank you so much. Yeah. Safe travels. And Vanessa has a hand raised. Go ahead, Vanessa.
Howdy. Yeah, I just really want to build on what was shared so far with Annette and Leah. And I was part of the previous FAQ. Are we doing 2.5 or 2.0 or 1.5? And a lot of the comments, or when we pulled focus groups, it was not being unsure exactly where Family Voice sat within the SOCAC, where their space was, what was what really was that question. And I think we've done a great job of really laying out what is the intention behind the FAQ, providing, that peer supports, initial entry, and on top of that, what we're building out is the framework to support folks, orient them into committee work as well as voting members. So really giving clarity as why we're doing the processes. And I've heard from folks that engage in the past of, okay, this makes sense. And yes, I get it, and feeling that support and feeling that it's become a more inclusive space where it's open to all. So it's been awesome. And yeah, I remind Leah, it's only been like 5 meetings and we've done so much. So yeah.
I want to add also that I think the work that's been done to get those voices, I think it allows those who show up in that space to feel like what they're doing has like genuine impact in what we're doing as a whole. That it's not just we're going to go in there, we're going to talk, and it may or may not make it back, but like just the process of gathering that data and showing them that we've gathered that data and how it's being processed gives them a sense that data is then going to actually be used, because it does have a quantifiable set of information that we can move on to the next phase. And it just feels like that has become more meaningful for those who are involved.
Excellent. So we are actually already at time for this conversation. What other ideas or questions do you have on our implementation plan? Can we do if people have questions, are there questions? Implementation, strategic plan, where are we? I don't get it.
I don't have questions.
I don't have questions?
I have a comment.
You're the chair, sir.
Well, I'm just thinking about, as far as how are we collecting and talking about the work happening, these action leads, the column that is action leads, right? Those are state agency folks. Are we getting a regular reporting cadence from them about these things? And if no, should we implement that and expect that, and then have our SOCAC, our System of Care Advisory Council sponsor review those? And is that a quarterly cadence? Is that a monthly cadence? What does that look like? And I see some gaps on some of these action leads where there isn't anybody from agency land, but we have different agencies identified. So should we then push our agency partners to identify someone for any of those gaps as a method, again, to say we are the governor appointed board to kind of run this thing at a 30,000 foot level. So we expect you to provide information to us and move towards the goals that we are setting.
So we've done that for 26 stuff. Yeah. Anything in for maybe some of the ones that you see that are blank are 28 or 29.
Maybe, yeah.
But for 1.1.1, this develop, recruit, these folks, Billy Cordero, Jenny Coakley, Kim, they get this email that says, what do you have to update us on? So far, we're not getting a ton back. So that's where we need some of our agency heads to say, this is part of your job. You need to be responding to those quarterly update requests.
Remy Watts, ODE. Totally, yes, like everything you just said, Adam. And I was going to say, Anna, like if you face some pushback for any reason in getting those agency reports from the governor's office, let us know at ODE. We'll fix it really quickly. And it's also notable that I think that these updates, especially around the strategies that you've aligned with our agency partners, are really helpful. Like, we don't do any collection of strategy implementation from the community standpoint. Like, that's a huge gap that I really hate and also don't personally have the capacity to work on at ODE. Like, what are our community partners doing around these strategies that we are trying to push forward at the state level? And that's really valuable information that y'all are collecting. And it's really like, you know, if you're having difficulty getting information from your agency partners, offering that information is really valuable. And then also number two, if I've like the Smartsheet emails, I've realized that I miss automated Smartsheet emails all the time because I think they're junk, and that's my fault. So that might be
Any updates from Remy?
that might not just be a me problem. I like to assume the positive intent. I think I'm probably not the only inept state administrator around here with Smartsheet emails. So.
But that's good feedback for us because that's the strategy that we've been prioritizing. And so if we need to do, hey, keep an eye out for this Smartsheet email, kind of
a warm email or a warm Teams message. That is how I have done my travel reimbursement in the last week, is because my admin Teams me and slap my wrist.
Sorry.
Excellent. That is really helpful. Adam Peterson or Adam Rutkowski. Jesse.
Yeah, do we have the power or authority to make people give us that information? Because I remember back in this like data collection times, we had a bunch of, we can't give that out, we won't give that out, we don't collect that.
That's different.
Yeah. Okay.
So we do have the authority to basically say, you have to tell us what's happening here. But I think to Remy's point, we're also helping the agencies market where they're improving and how they're doing better. And that's not something that they've done. So they should see the buy-in for it, and if they don't, then that's where we have authority to kind of be a little more.
Okay, because I worry about that whole system accountability piece.
100%.
Ebony,
you're our last comment or question, and then we will move to the closing up.
Yeah, no, I was just gonna ditto to having some type of a little bit of just a prompt, but OHA, I'm happy to make sure that we're, responding, providing the information we should. And the goal will be to make sure that then we gain ease and practice where then, we're ahead of any prompts. But yeah, so happy to support to make sure that we're doing better on the OHA side.
Awesome. Yeah, and this is a new process. So this is not a y'all have failed us and we're all disappointed in everybody kind of conversation. It's a hey, we're just starting this thing. How can we do it? How can we improve on the very first step we took? What step 2 should be better? So this will be, June will be step 2. We will do form handoffs. We'll follow up with leaders. We'll be a little bit more proactive in letting folks know they're coming down. CJ?
Sorry. I appreciate the conversation. Relatively new, I guess. I mean, I probably jumped on a Zoom a time or two, maybe. I don't know how long this has been going on, but I guess there's some really things that concern me as somebody who represents tribes. Is one, just going through this briefly again, this is the first time I've actually seen this probably, but you have lack of tribal input as a limitation, but nowhere else do I hear or talk of mention of tribes in any of this. And that is a huge red flag for me and for the other 9 tribes of Oregon and the NARA urban population that are here in Portland. So I don't know how you're going to affect change if you're not even including the first people of this land. And that's a really huge concern for me. And when it says, I mean, this is just a little short blurb of I want to know what you did to get tribal consultation, who you talked to, and how often was those conversations had or not had. Because you came up with a whole plan for the next, I don't know, however many years, and you don't have any tribal, there's nothing even in your parking lot that says, we will continue to try to get information from tribes and to add into this strategic plan or your implementation plan that you have. And so again, that's why I'm guessing people from tribes don't want to have anything to do with you because you're not really including them in any part whatsoever. And not to say that other people aren't important in the state of Oregon, but realistically and historically, the 9 tribes of Oregon were here before the state of Oregon was even here. My tribe signed our treaty in 1855. State of Oregon wasn't even a state then. So again, where is those folks in this and how are we getting that buy-in from those folks? So I think that's my, just sitting here and listening, we're talking about a lot of this stuff that have a huge impact on tribes because a lot of us are rural. There's not very many tribes. There's some tribes up and down the I-5, corridor here, but they're even rural. So yeah, I guess I just need to read a little bit more, but just glancing through this, I don't see one mention of tribes other than that one little section in this entire book. So,
Yeah, I'm happy to talk to you more about that. Thanks for calling it out.
And I see things, comment in the chat. There's asking, how can I understand who's being sent a request? You can see that a couple I could chase.
I'm sorry, let me get to the chat. How can I understand who's being sent requests? I can see a couple that I could chase. Hillary, if their name is listed in that implementation plan and they work at OHA, those are folks who are getting requests. Happy to follow up with you and see if we should move different people or if there are folks that you would be happy to chase for us, that would be appreciated. So moving into the announcements and closing, we already introduced Araceli. Very excited to have her here. I'm going to be reaching out to you all. I actually had a really incredibly useful 30-minute conversation with Courtney, where I was like, oh my God, I forget how much you know about so many things, and we are not using your skill set and experience to the extent that we should be. So I'm going to try to reach out to all of you for 30-minute meetings and try to make sure that we as staff understand how to call you in to the right conversations. You may not be on the subcommittee that's doing the thing, but you may know a lot about it. So inviting people to set up 30-minute meetings with me. We tried to do like 15-minute office hour kind of things, and that didn't really work. And so this is trying a different strategy to try to figure out how can we make sure that staff know what you are really bringing to the table so that when you have something to offer, we're invited. Sometimes you don't know that you know something that we should be discussing. So we're going to try to do better at inviting you all into those conversations by better knowing you and understanding what you have. So we'll be reaching out for those. And then we're doing a leadership training for the folks who are members of FAC and Youth Advisory Space, the YAS. To step into the subcommittee spaces. It will be on July 6th in Salem. It's actually going to be in the Human Services building. So location has been decided. And we'll be providing lunch. It's a 2-hour training. Our lived experts are 3-hour training, and our lived experts are working with Elliot to craft the agenda, make sure that folks who are stepping into committee spaces have at least some of the information they need to feel more confident and competent stepping into that space. And there will be a repeating kind of series. So this will be the first time, and then we'll continue to get better as we do it over time. So the folks who are registered for that, I think know they're registered for that. And we are working on figuring out transportation and stuff. So I think that's it. Okay. And then everybody who is an governor appointed member of the council or Chief Justice of the Oregon Supreme Court appointed member of the council for Judge Gates, you have mandatory workday trainings. They are due by December 31st. So you have plenty of time, but a lot of folks have a hard time getting into workday. It can be annoying. Karina and I can help you, but we can't help you the last week of December when you're frantically trying to get your trainings done. If you could do it sooner rather than later, we would really appreciate it.
Since my tenure ends in January, can I just not?
I mean, there is really no consequence, but I can't tell you that you can't do that.
I'm just wondering.
That's like a driving instructor's like,
I know, right?
you have to go the speed limit, but I cannot tell you legally to go over. So I should go like 2 over? I cannot tell you to go over.
And then next meeting's coming up on July 7th. We have our annual public meeting training, specially tailored to System of Care Advisory Council, which is coming from the Oregon Government Ethics Commission. It is online, 11 to 1. If you are there for the actual version of it, you get a little certificate that says you know how to be an ethical participant in a public meeting. If you watch it on YouTube later, you don't get the certificate, but you still know the information. And then September 1st and 15th are our next regular council meetings. December 15th, we'll be here and we will not only do a discussion and decision, not a reports and updates meeting, but we'll have a short end of year celebration. So do try to come if you can. Leah.
The July 7th, the
government ethics training.
Thank you. The calendar invite is just a hold right now. Is that going to get updated?
Everybody should have a hold on there and we during our regular scheduled times from 11 to 1. And they will be hosting it for us. So once I get that link, I'll get that sent out to everybody.
The Oregon, it comes from their Zoom, because then that way they can track attendance and make sure that they're only giving the certificate to folks who were there for so many minutes. So we have to replace it with the link and we don't have it from them yet. Okay. You should have a hold on your calendar from them.
It says that virtual only, but you were saying that.
It's not in person, it's only Zoom.
Okay. Yeah. Got it.
And then there's the post-survey meeting link, Corinne, if you can post it in the chat. And folks, it's really helpful if you fill these out, even if you're here in person. So we'll email you the link if you can go ahead and submit it today so you don't forget. We would give you a virtual cookie.
I get a star.
Or you can get a star. And that concludes our June 16th meeting. Thanks, y'all.
Virtual cookies. I clear my cache of this.
Good idea.
So what you just did was you reached out through each of the 4 participating